Good afternoon. I'm Julia Wagner, and I'm president of PA Lyme Resource Network. We are a group that advocates for patients' rights. We educate, and we also educate doctors, running now 6 annual CME medical conferences in the state of Pennsylvania. We're here today to talk about and to advocate for HB 629. We are calling for action on this bill that is a life-preserving measure and treatment that should be available to patients in Pennsylvania. We have been working to close this gap for way too long. We have more cases of Lyme disease than any other state in the nation, and it continues to grow. The cumulative cases of Lyme disease in Pennsylvania are in the millions. A fraction of those, 10 to 20, possibly 30%, continue to have progressive and chronic disease. HB 629 is a really simple bill, actually, because it's just trying to correct what isn't happening, and that is physicians' judgment. When a patient fails short-term treatment, when they decide they need longer treatment and they write that prescription as they are licensed to do, the insurance companies choose to practice medicine and they deny that treatment. That is not the way that things should work. HB 629 is only about ensuring the physician can do their job, and if they write a prescription for longer treatment for a debilitating disease, then the insurance company should pay. That is the gist of 629. What is ironic is that the CDC's own studies have shown us that 50% of doctors who prescribe treatment for Lyme disease in the United States, 56% prescribe way over the 28-day limit that the IDSA propagates and that the insurance companies abide by. So 56% know that longer treatment is needed. That's a CDC study over 3 years that looked at real data and real patients. So why isn't insurance covering what the doctors are prescribing? We have a full agenda today. I could talk for hours on this, and I have been for 12 years advocating for children, for all Pennsylvanians who suffer from these diseases, who are merely asking for a treatment that acne gets freely, that rosacea gets freely, that mycoplasma and other chronic infections get freely covered by insurance companies. It's been a long time, but today we have an incredible lineup of experts who are here to address what are lingering questions with our Senate. We need to clear things up and move on and do the right thing. I'd first like to acknowledge the tremendous support we have in Representative Kathy Rapp, who is the sponsor of this bill. If Kathy's arrived, you can raise your hand. She's here. Thank you. And also, she will be saying a few words in a few minutes. Thank you. We also want to acknowledge Senator Michelle Brooks, who is the sponsor of a similar bill, SB 100, and she's been very supportive of addressing this gap as well. And then I'd also like to acknowledge Representative Rosemary Brown, who's over here. She has been in the trenches fighting for action on this disease for a long time. You're welcome. And Representative Rothman, who is also here. Raise your hand wherever you are. Thank you. And for all the senators, we have a significant number of senators who are backing this bill, who are co-sponsors, more than you normally see on a bill. I thank them all for stepping up and being courageous to encourage our Banking and Insurance Committee to do the right thing. Thank you. So you see behind me that we have a tremendous number of children and youth. And would you all please stand up if you can? Okay. Children and youth, please stand up. Okay. Pennsylvania is #1 in Lyme disease cases, but you may not know that about 40% are children, teens, and young adults. That is what brought me to this, because of what we saw with young children who, when diagnosed properly, could recover from debilitation with the right treatment. And that is why we're here today. I'd like to give you a sense of what this disease does to our children. These are children that are here, that are representing the many thousands that we've seen across our groups, across this state. I'm going to talk first about Cameron. And Cameron, if you could just wave your hand. Cameron has missed a significant amount of college. She was a world-class, well, probably state class, tennis player who suffered from severe tremors, fatigue, excruciating headaches, and cognitive decline and brain fog. And she is only better today and back to school because of long-term treatment. Camille, please wave your hand. Memory issues and headaches, just a sampling of her symptoms, again, in and out of school. Casey, severe cardiac issues. POTS, where he would completely have tachycardia and almost pass out. And he also had significant changes in his eyesight. Valerie, whose father and mother are here, you'll hear her story, but she had brain encephalopathy. That's inflammation of the brain that has caused serious psychiatric symptoms and excruciating fatigue. Michaela, raise your hand, anxiety, vision impairment, and much more, restored with long-term treatment. Josie, who cannot be here because she's having the third of her eye surgeries to restore her vision lost due to Lyme disease. She's had about 8 joints replaced. She is in her early 20s, and she got bitten as a tick when she was 10 years old. Shay, severe fatigue, night sweats, brain fog, excruciating chest pain to the point they thought she was having cardiac arrest. My own son, Peter, had a relapse last year. He had significant cognitive decline, going from an AB student to a DF student, restored with long treatment. And our son, Sam, right here, who has developed degenerated nerves, cardiac arrhythmias, POTS, and had been bedbound for 2 years with long-term treatment managed by an excellent, brilliant doctor. He actually is able to walk for short distances now. It's sad for us to see him in a wheelchair again, but he is walking. And last of all, I would like to acknowledge that we are seeing deaths due to these diseases. Last year, in just Bucks and Montgomery County, we memorialized 3 deaths, and 2 of the families are here. 25-year-old Pete Smith, if you could stand up, Angie, in the back. Pete Smith developed severe symptoms that went untreated and undiagnosed until he had full heart block when he was hospitalized. And he did have a pacemaker inserted, and he was put on IV antibiotics, but they followed the rigid IDSA guidelines, and they removed his pacemaker and stopped his IV treatment because he was given the length they said should work, and within a week he was dead. Within a week. His mother was told he would be fine. 25-year-old Pete Smith. 29-year-old Kevin Fury, his mother is here, first had tick bites in elementary school and had them throughout his school years, always only treated with 2 weeks of antibiotics. He progressed in his illness. They didn't know what it was. Once they discovered it, it had progressed so far it was difficult to treat. He did continue to get some treatment, but it was intermittent, and he died in his sleep at the age of 29. This is not a simple disease. I want you to understand we're talking about a treatment that acne, rosacea, and very benign diseases get. That's all we're asking for, but most importantly, we're asking for the doctors to make the decision with their patient, as they are licensed to do, and that the insurance companies cover that and not practice medicine by denying a viable treatment. We delivered last week over 500 heart-wrenching letters. So in addition to everybody here, all but 4 senators in this state received heart-wrenching letters about the impact of this disease. So this is not just one area of the state, it is everywhere. Now we welcome Representative Rapp, who is the sponsor of HB 629. Thank you.
Thank you, Julia, and everyone for being here today. It's nice to see the enthusiastic support from the Senate, so let's give calls to your Senate and get that enthusiastic support so that that bill actually gets to the floor for a vote. So, but regardless, I'm very happy to see the enthusiastic support from the Senate, and that is where we need to focus right now. I think this bill, I am honored to have been the prime sponsor of this bill, but obviously there is some snag somewhere over in the Senate, so let's carry on that enthusiasm over there, Senator, and get this bill to the floor for a vote. You know, folks, I really am happy to be here and proud to be the sponsor, because I don't think there's one legislator in this building that doesn't have a constituent who is suffering from this terrible disease. And we're starting to hear more and more from research in the medical community. I think probably all of you know more than me, because you're in the trenches with this illness, that we are now looking at a possible favorable vaccine for Lyme disease. I'm hoping that eventually that really is true, that we see a way to really get this disease under control. And I also want to give a shout out to East Stroudsburg University. As the Health Committee Chair, we visited the university just a couple months ago. So informative. They're doing great work right here in Pennsylvania to try to get the word out that the legislature, the university, and what we really want to see is, with passage of this bill, we want to make sure that nobody is interfering with that relationship between your doctor and making sure that that doctor has the ability to prescribe what's going to help alleviate this horrible, horrible disease from these nasty little critters. So thank you so much for having this today. I'm really honored to be here. But I also wanted to make, just give some special recognition to Representative Rosemary Brown. She has really been a leader on this topic for several years. The university, I believe, is up your way, Rosemary, and she's really led the way in a lot of this area. So my thanks to her for her support and being also a real leader on Lyme disease. Thank you so very much.
So I wasn't on the agenda, but listen, it's not a pleasure, technically, to be in front of you with this type of public health crisis, but it has very much been a concern for my area. It came to my attention as a legislator, but obviously it's very strong in Pennsylvania. We are #1 in reported cases, which I think many of you here know. But I think this is a comprehensive effort too. PA Lyme Network's doing a fantastic job. Now we're talking about Lyme, and we're talking about other tick-borne illnesses too, which really need to be in the conversation. My efforts have definitely been behind, let's not miss the diagnosis. How do we get ahead of it so that, unfortunately, we don't have what some people are suffering with, as were mentioned, especially our children. And that is where the tick testing came in. If you're lucky enough to find a tick on you, which you know doesn't always happen, you may be able to find out if it's positive, work with your doctor, and let that doctor make the decision with you what will work to get you better. And let's take this seriously. Let's train our doctors and educate our doctors the best we can. Doctors have it very difficult. This is a disease state that there's not a lot known about. We have pieces of research, but the doctors have a lot on their plates, but we need to get them kind of honed in on this and really understand and not miss the diagnosis. They are human, but we want to try to help them not miss this diagnosis. So the efforts continue on my end. I will help in any way possible, and I wish you all very much the best of health, and please stay in touch with us. And nice to see smiling faces here, so thank you. Thanks for including me in.